Hello and welcome. I'm Dr. Codiff, and this is Chapter 11, the Muscular System, Appendicular Musculature. Appendicular muscles are responsible for stabilizing the pectoral and pelvic girdles, moving the upper and lower limbs, absorbing shocks and jolts as you walk, run, jump, and aid in strengthening the joint area. Two major groups of appendicular muscles are going to be the pectoral girdle and upper limbs, and the muscles of the pelvic girdle and lower limbs. So just like we saw with the skeleton. And you can take a look at these muscles here. So what you want to do is slow down, pause, and identify all of the different structures when you see a slide like this. And use all of your resources. You look at your book during these times as well. So let's go through a couple of these and look at the vocabulary here. Some muscles that position the pectoral girdle. So these muscles originate on the axial skeleton. So that center piece you could see in yellow here. Okay, so that center area in yellow, the axial skeleton, and insert on the clavicle, which is your collarbone, and the scapula, which is your shoulder blade. Muscles that move the arm. These muscles originate on the pectoral girdle and the thoracic cage, or that rib cage, and insert on the humerus, which is the upper arm bone here, the humerus. Let's use a different color. Okay, that upper arm bone is the humerus. Muscles that move the forearm and hand. These muscles primarily originate on the pectoral girdle and the humerus and insert on the radius, ulna, and or carpals. Carpals are just the bones of the wrist. Radius and ulna. Radius is the thumb side, like thumbs up, rad. And then the ulna is the other side. Extrinsic muscles of the hand and fingers. These muscles primarily originate on the humerus, the upper arm bone, the radius, the lower arm bone closer to the thumb, and the ulna, and insert onto the metacarpals and phalanges. So your carpals are going to be about in here. Your metacarpals are going to be where your palm and your hand is. The phalanges are your fingers. Intrinsic muscles of the hands. These muscles originate primarily on the carpal and metacarpal bones and insert on the phalanges or the fingers. Muscles of the pelvic girdle or lower limb. Muscles that move the thigh. These muscles originate on the pelvic region and typically insert on the femur, which is this bone right here, the femur. Muscles that move the leg. These muscles originate on the pelvis and femur and insert on the tibia, top, and fibula, L for fibula, lateral. Okay, so that's the lateral bone all the way down. There we go. Okay, so the lateral malleolus is the fibula, remember. Medial malleolus all the way down to the medial ankle there. That's the tibia. So extrinsic muscles that move the foot and toes. These muscles originate on the tibia and fibula and insert on the tarsals, which are going to be the foot bones here, metatarsals, and phalanges. Phalanges are going to be your toes. Intrinsic muscles of the foot. These muscles originate primarily on the tarsal and metatarsal bones and insert on your toes or phalanges. Action lines of the shoulder joint. So direction of pull, flexion, extension at the shoulder joint, abduction and adduction. So bringing in is add in, abduct is away from the midline. Medial and lateral rotation of the shoulder joint. So you can see these action lines of the shoulder joint here. So here's the deltoid. You can see that it has that triangular shape here. So here's a superficial lateral view showing the action lines of the deltoid, bicep brachii, tricep for extension, that tricep. Analyzing these action lines across the shoulder helps determine the actions of the muscle on the humerus or that upper arm bone. We have spur and shunt muscles, so flexors and extensors. Spurt, muscle that inserts close to the joint. Shunt is the muscle that inserts far away from the joint. So we see bicep and tricep here, bicep being flexion, okay? And the spurt muscle would be that bicep. Tricep would be a spurt for extension, and then shunt for brachioradialis being stability and movement here. Action lines at the hip joint, flexion and extension, abduction, so again, away from the midline, adduction in towards the midline, okay. Medial rotation and lateral rotation. And we could see the femur right here and these adductor muscles, bringing the leg in or press your knees together. That's adduction, right? Muscles associated with the pectoral girdle and upper limbs can be divided into 4 groups. We see muscles that position the pectoral girdle, muscles that move the arm, muscles that move forearm and hand, and muscles that move the hand and fingers. These muscles also coordinate with the muscles that move the arm. So we'll see trapezius, remember that's on top, trapezius top, right? So your shoulder muscle. Rhomboid is going to adduct the scapula. So if you bring your shoulders together in really good posture, that's the rhomboids between your shoulder blade and your spine, okay? Adducting the scapula. Levator scapula elevates the scapula. Pec minor protracts the shoulder or makes it look like bad posture. Serratus anterior protracts the scapula. Now that's good posture when you're protracting the scapula. Subclavius protracts the scapula as well. And you can see some of the muscles on this side here and then some of them here. So take a moment, pause this, really work this out, write the names of the muscles out over and over and over again. So we see trapezius here, trap top, lats lower, right? So remember that, traps top, lats lower. And then we can see in here the deltoid, that triangular shaped muscle here, and we'll see it in the front too, anterior delt, you just can't really see it very well here. And then we see infraspinatus, teres minor, teres major, and triceps brachii, all part of the appendicular musculature. We also see latissimus dorsi again back here, the thoracolumbar, big old band of fascia right here. It's this kind of triangular band of connective tissue. Here's the iliac crest, okay, of the ilium. And then you can see axial muscles here, SCM, sternocleidomastoid. Okay. Axial muscles, semispinalis capitis. When you see cap, that means it goes up to the head. Splenius capitis. So you put a cap on your head, like a baseball cap. Okay. And then we see appendicular muscles over here. So levator scapula, elevating the scap or the shoulder blade, and it's under here. Supraspinatus. So remember, this is the spine of the scapula, that part of the bone of this scapula bone, the spine of the scapula. So supra above the spine of the scapula. So this muscle right here, it's going to wrap around to the kind of front part of your shoulder too. So supraspinatus. We see rhomboid minor and rhomboid major. In general, minor, smaller and on top. Major, bigger and on bottom. Okay. This one's cut away here, but it was right here. Okay, right here. Rhomboid minor, rhomboid major. That's going to give you good posture when you fire these off. It's going to bring that shoulder blade towards the spine. You can see serratus anterior fibers a little bit there. You could see the latissimus dorsi cut away, but we're looking here, levator scap, supraspinatus, rhomboid minor. Remember we had a serratus anterior, so now we're seeing parts of the serratus posterior. Okay. You can see serratus posterior back here as well. On bodybuilders, to me, this always looks like back abs, right? So you get the six-pack abs in the front. And to me, that's what this looks like in the back. When someone has well-defined serratus posterior, it looks like abdominal muscle six-pack style in the back. And it's the serratus posterior. You can see some of the external oblique and the internal oblique, and then you can see erector spinae here, and these are again our axial muscles here. So erector spinae being iliocostalis, longissimus, and spinalis. And in the front here, you can see the axial muscles here of the platysma. Remember, that was cranial nerve 7, cranial nerve 7 for that platysma, very superficial neck muscle there. Okay, and then we see appendicular muscles here. You can see the front part of that deltoid. You can see pec major, that muscle right here converging in. You can see a little bit of latissimus dorsi in the back here. Okay, so you can see a little bit of latissimus dorsi, and that's that lats lower traps top, remember? And then we see some more axial muscles here, your external oblique. You can see the rectus sheath here. And then if we come up to the top, you can see axial muscle of SCM again. Sternocleido is the clavicle, remember? So sternocleidomastoid. Appendiculars here, traps top. Okay, and we see the deltoid, we see pec minor attaching to that coracoid process here. And then we see subscapularis. So we haven't seen that one yet. So subscapularis, remember the subscapular fossa of the scapula of the shoulder blade? It was in between the shoulder blade and the thoracic spine. And so subscapularis is the muscle in that subscapular fossa. You can see bits of pec major. And then here's that good old coracobrachialis again from the coracoid process to the brachial or the arm. And then you can see bicep brachii, bicep 2. Okay, so it has 2 heads. Bicep, septing head here. So 2 heads, a short and a long. You can see teres major from the front here. We saw it from the back. We see serratus anterior here as well. Axial muscles being external intercostal, internal intercostal. Recall intercostal is just in between the ribs. Internal oblique, external oblique, and rectus abdominis. Those are our abdominal muscles. And the transverse abdominis is part of our abdominal muscles as well. Transverse is going to go this way. Rectus abdominis is this way. External and internal oblique are these over here. So slow down, hang out with this, write it out a couple of times, and it's helpful that way if you just kind of keep writing it out, use your resources of the blank muscle pages. There you go. So that is the end of our chapter here. Whoops, it is not. That's all right. So deltoid here abducts the arm. That was just an extra blank slide. It caught me. All right, so deltoid. What did deltoid mean? Looks like a triangle. Supraspinatus, again, above the spine of the scapula, below the spine of the scapula. So supraspinatus is going to give us abduction at the shoulder. Okay. Infraspinatus, lateral rotation of the shoulder. Subscapularis, medial rotation at the shoulder. Teres major, extension and medial rotation at the shoulder. Teres minor, lateral rotation and adduction at the shoulder. And this is not in your book, but I threw this in here because I like it. It gives us some really simple color-coded what muscle is what in the rotator cuff. You have 4 muscles in the rotator cuff. Okay, so it's the sits muscles. Sits is how we memorize it. Sits. And the tricky one is this, teres minor. It is not teres major, it is only teres minor. Minor is smaller and on top, so it's closer to this triangular bunch of muscles here. Supraspinatus above the spine and the scapula. Let me grab a highlighter. There we go. Spine and the scapula is right here. And so above that is supraspinatus. Below that is infraspinatus. And then teres minor just below infraspinatus. Very hard to differentiate between infra and teres minor. I mean, it's easy here because it's color-coded, but it's not color-coded in the body. And then we see subscapularis over here. So this is the front of the body here. And so the rib cage would be here. Okay, so the chest would be here. That's been removed. The chest has been removed, and now we're seeing the shoulder blade, but this inside here. Okay, so this is the back of the head here. This is the inside here. This is the humerus here. You can see the coracoid process right there. Let me grab a different color so you can see it a little bit easier. Remember, on the front of that rib cage, we're going to see coracoid process and that pec minor, bicep, coracobrachialis. Also, subscapular sits muscles. You will have a test question based on that. Coracobrachialis, that muscle gives us adduction and flexion at the shoulder. Pec major adducts, flex, and medially rotates the arm. Latissimus dorsi, lats lower, gives us extension, adduction, medial rotation at the shoulder. And then that rotator cuff is what we just saw, the sits muscles, supraspinatus, infraspinatus, teres minor, and subscapularis. And take a look at the muscles here. You could see them. Again, we've covered a lot of these. Here's pec, here's deltoid through here. And you could see muscles moving the arm over here, subscapularis. And we see coracoid process right there. So we see coracobrachialis right here. Oops, there we go. Okay. And then you see the biceps short head right next to it. Oops, let's get better colors, shall we? All right, so coracoid process, the little bony process there, coracobrachialis, and bicep short head. There's a short head, there is a long. Okay. Bicep long head right next to it. You could see teres major kind of peeking around from the side here. Okay, teres major peeking around. Good. And from the back, you could see spinous processes down the center of the spine here. You can see lats lower right here. You could see the deltoid, that familiar triangle shape here, right here. You can see supraspinatus right here above the spine of the scapula. And here's the spine of the scapula on this side. And you can see supraspinatus. You can see infraspinatus here. And then again, teres minor, hard to differentiate. And teres major, bigger and on bottom. And then you can see the tricep. If the bicep was 2 heads, tricep is 3. Okay, so triceps. Great. So extensor carpi ulnaris, the carpal bones, and the ulna. Okay, so extensor is going to extend. Okay, so extensor carpi ulnaris, extension and adduction at the wrist. Triceps brachii is going to be extension at the elbow. Bicep brachii is going to be flexion at the elbow and supination or palm up at the forearm. Brachialis is flexion at the elbow. Brachioradialis is going to be flexion of the elbow, but think of the action of holding a cup of water and bringing that cup of water up to your mouth. That's going to get that brachioradialis activated. Anconeus is a little muscle at the elbow, and it's going to give a little bit of extension at the elbow. Pronator teres pronates the forearm, and supinator supinates the forearm. Flexor carpi ulnaris, flexion and adduction at the wrist. Flexor carpi radialis, flexion and abduction at the wrist. Palmaris longus gives us flexion of the wrist. Extensor carpi ulnaris gives us extension and adduction at the wrist. Extensor carpi radialis, extension and abduction at the wrist. Extensor carpi radialis longus, and then a brevis. Brevis is just short. And pronator quadratus pronates the forearm and the hand. And you can see them right here. So muscles that move the forearm, flexors at the elbow. We see bicep long and short. See brachialis kind of peeking through here. And then brachioradialis, the one that's going to give us the action of bringing a cup of water up towards our mouth, that kind of flexion. And then we see on the other side here, we can see triceps. We see a long head and a medial head over here. We see pronator teres. We see muscles over here, move the hand, and we see flexors at the wrist, flexor carpi radialis. Right here. Oops, right there. Let me do that better. Right, flexor carpi radialis. Remember the radial side, thumbs up, rad. Okay. And then we see palmaris longus in the center. And then flexor carpi ulnaris on the ulna side. Flexor digitorum superficialis, flex the fingers. Pronator quadratus, palmar carpal ligament over here, and flexor retinaculum. That flexor retinaculum is traditionally the area that gets cut if someone were to have carpal tunnel syndrome surgery. Muscles that move the forearm over here, extensors at the elbow, tricep. We see a lateral head, we see the long head, we see the anconeus over here. You see the olecranon, or the pointy part of the ulna bone. We see this muscle, brachioradialis muscle right here. Again, that's the one that's going to flex the arm up in a drinking water position. You can see our extensors here. Okay, extensor carpi radialis longus. And then if we have a longus, we're going to see a brevis. Okay. Extensor carpi ulnaris over here on the ulnar side. And we see extensor digitorum, and that's going to extend our fingers. Extensor pollicis brevis and abductor pollicis longus. Pollicis means thumb. Okay? Pollicis means thumb. Muscles that move the forearm, we see our supinator, making our hand go palm up, and our pronator teres here, pronating or making the palm go down. Okay? We see pronator quadratus doing that as well. All right, so these are all just going to be what they do. We're going to extend or we're going to flex. Digits are your fingers. Okay? Digits are your fingers. Pollicis is going to be your thumb. Okay? We have short and we have long. Okay? Now, profundus means deep. Okay? And the one that goes along with that is superficialis, is more towards the surface. Okay? Extensor indices, that's going to just be your index finger. Okay, good. Extrinsic muscles of the hand, the tendons and the muscles listed on the previous slide pass through a synovial tendon sheath located within the wrist area. So you could see this medial aspect over here and then the lateral aspect here, and check out these muscles. So again, pollicis means thumb. Okay. Digity mini-me is your pinky finger. Funny little name, right? Like mini-me. Okay, so abductor digity mini-me. I'm gonna bring your pinky finger out like you're drinking tea, right? And then pollicis brevis, that's the thumb, pinky finger, right? Good. And then you can see all of the very intrinsic muscles of the hands here. Feel free to pause on any of these and check those out. Let's look here at the anterior compartment and the posterior compartment of the upper limb. Anterior is going to be bicep, brachialis, and coracobrachialis. Posterior compartment is going to be tricep. Forearm is divided into 4 compartments. We're going to see a superficial anterior, deep anterior, a lateral, and a posterior compartment here. And you can see the different muscles grouped this way. We're going to look at muscles that move the thigh, muscles that move the leg, muscles that move the foot and the toes. So muscles that move the thigh, they're going to originate on the pelvis. Many are large and powerful. So we're looking at 4 groups: the glutes, lateral rotator, adductors, and iliopsoas. The P is silent, just like those pterygoids had silent P, right? So the pterygoids, like pterodactyl, right? Silent P. So iliopsoas group. So let's look at the glute muscles here. So gluteus maximus, medius, minimus, and then we put TFL in here as well for glute muscles. However, it's not a glute, right? And so glute max is going to be, oops, I don't know how I did that. So bear with me a moment. There we go. So glute max is going to be major extension of the hip. It's going to give a little bit of lateral rotation, but it's our major hip extensor. So when you kick your leg back out behind you, that's your glute max. Okay? Glute med is going to be abduction and hip stabilization and medial rotation of the hip. Same thing for glute min. So glute med and glute min are going to be buddies, and they're going to do the same thing and help each other out. Tensor fascia lata is going to give extension of the knee and lateral rotation of the leg. And you can see the muscles here. Okay, so our deep 6 lateral rotators all have these crazy names. It's piriformis, you might have heard of that one, like piriformis syndrome for when the sciatic nerve gets irritated from that muscle. And then superior gemellus, obturator internus, inferior gemellus, quadratus femoris, or what we call our deep 6 lateral rotators. You can see the little ischial tuberosity here, or that bony part of our sit bone there. Right? And then our glute group over here. So we can see, let me move that there. Okay. So the glute max right here has been cut away. Okay. Glute max, your major hip extensor, has been cut away. Glute med has also been cut away. It's going to attach down onto the greater trochanter of the femur. And then we can see glute minimus underneath that. So glute max, glute med, glute min. Iliotibial tract here, and we're going to see TFL become right here. Let me move some stuff. There you go. So TFL is going to become that iliotibial tract. Okay. Good. So our deep 6 lateral rotators, we saw that. Okay. Our adductors are going to bring the legs in. There's a short, there's a long, and there's a really big one. And then there's also pectineus and gracilis. Gracilis is a groin muscle. GR groin, GR gracilis. Okay, and you can see it right here, gracilis. One of the groin muscles right here. Okay. And you can see pectineus. And then the adductor group right here, longus, brevis. And let's clear that out. Longus, brevis, and magnus. You can see the 2 lines of magnus. Okay. It's really big. Remember, magnus means big. We saw foramen magnum in the skull, remember. And that's where the brainstem goes and becomes the spinal cord. Big, spot there. And then we look at iliopsoas. And so what iliopsoas is, here's ilio. That's for this muscle right here, iliacus. It's in the face of the hip because this is the ilium muscle or ilium bone. And then psoas major is right here. Sometimes you'll see a psoas minor too, but not everybody has a psoas minor. And then it becomes iliopsoas after it passes underneath. See how these two muscles pass underneath? That inguinal ligament. And we just call it iliopsoas muscle as it attaches to the lesser trochanter of the femur. Right? So iliacus and psoas going to give you flexion of the hip, or you're sitting, okay, inflection. So this is the antagonist to glute max. Glute max is your major extensor of the hip. Iliopsoas is your major hip flexor. Right here. Good. Over here, you can see some of the deep six lateral rotators, but that's on the other side. Right? So that's the posterior side. Over here, we see sartorius. Remember that talar muscle of the leg. Now we're going to look here at the quads. And there are four, as the name suggests. Okay, so vastus intermedius, vastus lateralis, vastus medialis, and rectus femoris. They're all going to extend the leg, and rectus femoris is going to get some flexion at the hip too. And they're right here. Okay. So you can see sartorius right here kind of coming across. You could see rectus femoris here. Here's the patella or the kneecap. And then from that rectus femoris, you look on this side here, the lateral side, that's vastus lateralis. You look on the medial side of rectus femoris right there. So look on the medial side and you will see vastus medialis, right? Extensors of the knee. So we're going to see four, but we never see vastus intermedius in a view like this because it's going to be under or deep to that rectus femoris. Okay, so we usually only see these three, even though they're the quads. So that could be a little confusing, but we never really see in these views the vastus intermedius. All right, bicep femoris, don't get confused with bicep brachii. Brachii is arm, bicep femoris is on the femur. Flexes the leg, extends the hip. We're going to see semimembranosus and semitendinosus, and collectively we're going to call these the hamstrings at the back of the leg here. Okay, so we can see glute max right here. And then we see TFL and the IT band. We can see glute med and a little connective tissue over it. We can see adductor magnus, the really big adductor. We can see gracilis groin muscle. This one right here, gracilis groin. And then you're going to see the flexors here of the knee. So bicep femoris, right there, long head. We're going to see semitendinosus, follow the tendon down. Okay, semitendinosus, you follow that big tendon down. Semimembranosus is going to be more medial. Okay, semimembranosus is more medial. And then we see sartorius a little bit from the back view here as well. There you go. So you can work on those and pause here and go back and forth and work those out. I'm going to keep going, so you go ahead and pause and work on that. So flexors of the knee. So we see sartorius, or that talar's muscle, allows for crossing of that lower leg. It's going to flex, abduct, laterally rotate the hip. It is not a part of the quadricep muscles. Popliteus is in that knee area here, it's going to immediately rotate the hip, and it's not part of the hamstrings. It's just in the back of the knee. And you can see here's popliteus, this little muscle right here. Okay. And then you can see sartorius right here. Extrinsic muscles of the foot and intrinsic muscles of the foot. Extrinsic muscles originate on the distal end of the femur or on the tibia or fibula, but move the foot and toes. Intrinsic means that it's only on the foot. Okay, so see how this is up on the leg and moves the foot? Okay, so this is only on the foot and moving the toes. We see these muscles, tibialis anterior, gastrocnemius, the back calf muscle here, the front of the lower leg here for tibia anterior. We see fibularis brevis. Brevis means short, remember? Longus is long. We're going to look at plantaris, soleus, and tibialis posterior. Gastrocnemius and soleus insert onto the calcaneal tendon, or Achilles tendon, you might call it. And we see the different retinaculum or stability tendons here. Back calf muscle is that gastrocnemius, the big back calf muscle. It's going to plantar flex the foot or point your toes. P for plantar flex, P for point the toes. Dorsiflex, the tibialis anterior, is going to, if you kept your heel on the ground here and lifted your toes up in the air, that's dorsiflexion, and that's tibialis anterior. Extrinsic muscles of the foot, we're going to see flexion, and we're going to see extension. Digitorum is just the toes. Hallucis means big toe. Hallux is the big toe. And you can see them right here. So flexor digitorum longus, flexor hallucis longus. Hallucis is the big toe. You can see fibularis brevis. You might see it called peroneus. Okay. And you can see tibialis posterior and fibularis longus. You can see the abductor hallucis. So again, big toe. Flex digitorum brevis, the other toes. Mini-me, just like we saw our pinky, this is our little toe. We see lumbricals, flexor hallucis brevis, digiti minimi brevis, and plantar aponeurosis. Let's take a look. So we can see lumbricals, these little teeny tiny muscles in here. Okay, the lumbricals. Flexor hallucis brevis, hallucis is the big toe, remember? Here's our big toe. Flexor digiti minimi brevis, the pinky toe. Okay. Abductor hallucis, big toe. Flexor digitorum brevis, abductor digiti minimi, pinky toe. Plantar aponeurosis, big old band of fascia. Okay, think about plantar fasciitis. Okay, so plantar aponeurosis or plantar fascia. Muscles that move the foot and the toes are the intrinsic muscles of the foot that do not go up to the leg, that just stay in the foot and toe area. Quadratus plantae, adductor hallucis, big toe, plantar interossei, in between the bones. And you can see them right here. Okay, so all these little teeny tiny intrinsic foot muscles. Okay. So intrinsics, external digitorum brevis, dorsal interossei. So look at all these really great little in between the bone on the dorsal surface or the top part of your foot. And these, we're good with that. Anterior compartment, posterior compartment. And we don't really need to know the compartments very much. Okay, so you could take a look at this if you like. Lateral compartment territory, superficial posterior compartment, deep posterior, anterior compartment. There's things called compartment syndrome, where the pressure has to be released if there's damage here, and the blood vessels are expanding these areas, and it's dangerous. Excellent. That was a long chapter. Make sure you take your time with the major muscle groups, and I'll see you for the next chapter. Good job. Keep up the great work.